So now I'm going to perform the Trach Care. The sterility of my gloves and package have already been verified. I'm going to wash my hands. I'm going to open up my kit. Take my drape. Place it over the collar. I'm going to put on my sterile gloves. So I'm going to go through my kit. I'm going to get rid of the gloves that I don't need and one of the hydrogen peroxides. I also have trach ties, which I'm not going to need for this competency, but if I were to need them or use them, I would have an assistant help me and they would hold the trach in place while I put the new ones on before I took the old one off. I take my hydrogen peroxide and I'm going to pour it in the larger of the basins. I'm going to take my normal saline. Half will go with the hydrogen peroxide and the other half is going to go in the basin by itself. Okay, now come over here. I'm going to break sterility with my non-dominant hand. I'm going to remove the inner cannula, making sure not to contaminate this part. Collar back on. I'm going to put this in the mixture of hydrogen peroxide and the normal saline. And I'm going to agitate it. I'm going to clean the inside first and scrub it. And I'm going to scrub the outside. I'm going to rinse it, and I'm going to rinse it off in the normal saline. I'm going to tap it. I'm going to make sure that all the secretions and excess fluid are off, and they are. So it's ready to put back in. I'm going to secure it, and make sure it is secure, and it is. And at this point, I'm going to remove the dressing. Discard this. I'm going to take my applicators. I'm going to clean under the faceplate around the stoma. I'm going to take my gauze. I'm going to clean the faceplate. I'm going to look for this dressing. Now I can use both hands while I place it underneath the faceplate. Make sure that it's straight under there and that it's comfortable for the patient. Okay. Now I can put the trach collar back on, snap it back in place, and I'm going to make sure the oxygen is back to the prescribed level. I notice that he's more comfortable, he's less restless, and that he's breathing a little bit better now. With it being cleaned, I'm going to wash my hands. I can raise the side rail. I'm going to discard of all my supplies. Make sure the patient is comfortable and that his call light is within reach. And then I'm going to document